And hi, good afternoon, everyone. Like Mary Lou said, my name is Margaret Lynn, and today there's three of us joining you today, and we're really excited to share with you about frailty and social prescribing. So I'm gonna share a screen here. You able to see the screen for now? Yeah. Okay. So, like Mary Lou mentioned, there is Dr. Grace Park, who's with us right now, and there's myself, and there's also Sandy Temple, who is working directly in social prescribing and bring us some very nice stories today. And so we are going to start the presentation right now. And I'm going to let everyone introduce themselves too as we get there. And mainly what we want to share with you today is the first bit by Dr. Grace Park on what is frailty and how can we prevent that. And then we'll learn about social prescribing, what it is and all about it and what is happening right now in BC and in Canada right now. And then the last bit, we want to share with you how social prescribing can help you. And then this part will be presented by Sandy with a bunch of lovely stories. So to get into our first part, we want to share with you what is frailty. And I'm going to invite Dr. Grace Park to introduce herself a little bit more and also to talk with us about frailty. Grace, could you unmute yourself?
Hi, can you hear me all right?
Yes.
Yeah, so I do have problems with my internet and I hope it's going to come through okay. I'm hardwired in, so it should be okay. But anyway, I'll just carry on. And do you have the slides there, Margaret? Okay, so go ahead. So hi, everyone. My name is Grace Park. I'm a family doctor in White Rock. And I've also been working with Fraser Health for the last 12 years as a medical director, overseeing home health services and community health services from Fraser Health to support seniors to remain independent in their homes for as long as possible. So frailty is a topic that I've been involved in over the last number of years. And so today I just wanted to share a little bit of this as a background and then go on to the social prescribing, which is a topic that's very exciting for all of us. So to start, we are in a lovely part of the world living here in Canada, and life expectancy has been going up as well in Canada over the last several decades that we've been following it. And so you'll see the red bar across the top are females, always living a few years old longer than males, but males also life expectancy increasing over time. And this is from 1920 all the way up to 2005. So we are definitely living longer lives. But the bad news is many of us spend the last 8 to 10 years of our lives living with frailty, which decreases the quality of life. Next slide, please, Margaret. When we look at Canada in general, there was a Canadian Community Health Survey that looked at something like 5 million seniors. And they saw in the years that they followed in 2013 to 2014, for a few years, that up to 22% of the people over the age of 65 were frail, using a frailty criteria. And by the time people are over the age of 85, almost 50% were frail. So that's an indication that as you get older, frailty does become more noticeable and definitely affecting people's lives. And more than that, we know that as you get more frail, you need the healthcare system more. And that ends up using a whole lot of our healthcare services. And so that really leads us to worry about the sustainability of our healthcare system. So next slide. So when you get to a certain age, you might see a person needing walking aids, starting to look like they might become frail, but it's not absolutely expected. And aging does not mean that you're going to get frail. And the next slide shows a fellow who's probably the same age as the last slide, but obviously he's fully active and very motivated and staying healthy. And so this is the variability that we see as people get older, that you do not have to get frail. So next slide. Frailty is really important because depending on the degree of frailty, it can actually predict how you're going to do when something happens to you. So a flu-like illness or a small operation or something like that. So if you're a managing well individual at the top green line, you'll have this stressor like the health problem, and it'll take a little while for you to recover, but you recover all the way back up to where you were at, the baseline, and then you carry on. But if you're mildly frail, even if you're mildly frail, you have that insult in your health, and then it takes you longer to recover. So a longer time to recover from an infection or a frail flu. And you'll see that your function does not go all the way back up to where you're at before. And then at the bottom, when you're more severely frail, that's when you take a really long time to try and recover back to your baseline. And you see people like this in the hospital, they never get back to where they were at before hospitalization and often end up needing help, and they become dependent. So next slide. So frailty can be measured actually, and you can actually say how frail a person is if they do have the diagnosis of frailty. It used to be that we just looked at what we call the phenotype, how an individual looks, whether they're losing weight inappropriately, they're slowing in the way they're walking, they're showing weakness, and they're fatiguing easier, they're not physically active. So those were sort of what we call the phenotype of frailty. But more and more, we're starting to become a little bit more specific in what we mean about frailty, what we mean by frail. So in the middle, we talked about the clinical frailty scale. So this is how a person is functioning. So when they're mildly frail, a person is maybe needing a little bit of a walking aid. And then when they're more severely frail, they're actually needing help inside the home with their activities of daily living, like needing helping with their bathing and personal care. And then most recently, we're talking about a frailty index, and that's accumulation of deficits with age, which means that as you get older, more things go wrong with you, with your health. Next slide. But we are seeing in our research and in the literature that early identification of frailty is really helpful because it gives you an opportunity to actually treat those issues that cause frailty and rehabilitate and become more robust and so less frail. So you don't have to continue to be frail. You don't have to become frail if you're able to do some of these things. And that Canadian survey that I spoke about earlier, it showed 22% people over the age of 65 are frail, but 32% were pre-frail. So these people weren't quite frail yet, but they were just starting to get to be that sort of a little bit of frailty starting to show up in their lives and their functioning. And it showed that even the pre-frail people, and certainly the frail people, actually died more readily, and their mortality were associated with that frailty. So even with things like cancers, heart disease, lung disease, people that were frail or pre-frail even tended to have a shorter lifespan. And it also showed that women were generally to be higher risk for frailty, but they live longer. So men tend to be less frail, but they didn't live as long because they had other reasons for their mortality. Next slide. So frailty can present in different ways, and you can even tell in yourself and certainly in your loved ones. You can tell if a person's mobility is starting to suffer, they're starting to need walking aids because of their balance, there's unexplained weight loss, they might have memory problems, needing more medication for medical conditions, increasing support needs, and then starting to become isolated because of these medical conditions and social issues as well. And next slide. So in the healthcare field, we have a tool that we've been using a lot. This is called the Clinical Frailty Scale. And this is used a lot, even in hospitals and certainly by family physicians. And you can see when you've got a scale of 1, this is a person who's very fit. They're still motivated, they're active, they're exercising, and they're probably the most fittest in their health category. And as they get less healthy, so a scale of 3, they're managing well, but they may have other medical problems. And then by 4, that will be what we would call pre-frail. They're starting to get a little bit slowed, and they're still functioning okay in the community, but they're starting to need some help. By the time you get to scale of 5, you're starting to need help with things like transportation and cooking, banking, etc. And by 6, that's where you're starting to need help with inside the home activities like bathing and looking after yourself. So these are the areas where as you get further along, you need more help, but there's things you can do to prevent yourself from getting further along this scale. Next slide. So early identification of frailty, as I said, was really important because as you get older, it's been shown that you actually get 4.5% increase in number of things that go wrong with you. And every 15 years, you double the number of things that go wrong with you. And so between the age of 75 and 90, you're doubling, and that's probably the last doubling time. And then between 60 and 75, you're doubling all the things wrong with you as well. But that is a time that you can intervene and try and reverse some of those components by developing some good care plans and treatments. Next slide. So this is really busy. And all I wanted to show you was that in this tool that's on the right-hand side of the scale of the slide, these are the health deficits that I mentioned earlier. So it could be your memory, it could be your mood, could be your motivation, your sensors like vision and hearing, your speech. And then in the middle would be your activities of daily living, like are you able to feed yourself and care for yourself? And then if you need help with other things like cooking and shopping, driving, etc. And then on the bottom are social things like, do you have enough income to make ends meet? Are you still married? Do you have a caregiver, etc.? So these are all these deficits that we tick off. And depending on how many things you tick off, yes, that would lead to an increase in your frailty index. Next slide. So the frailty index then is a number of things that are wrong with you divided by the total number of questions. And if you have nothing wrong with you, then you have 0. And if you have everything wrong with you, you have 1. But the scores are 0 to 0.08 would be non-frail. And then 0.09 to 0.24 is when you're pre-frail, and 0.25 and higher, we call it frail. And frailty index of greater than 5 really is associated with mortality over the following 20 months. And so it does actually give you a prognosis as well if your frailty index is higher. So next slide. But the good A is for activity. Can you hear me there okay?
Yes.
Okay.
Yes.
V is for vaccinate. And we heard about that earlier. And O is to optimize medication to ensure that we don't, take drugs that are maybe not necessary, try and reduce the number of drugs, reduce the dose of drugs as much as possible, and really go over it on a regular basis with your physician to see whether you still need to continue with these medications and keep that down as much as possible. Interaction is hugely important, that's socialization. And D is for diet, using food as medicine. So as you get older, as you know, protein is really important. And so these are the 5 things that you need to keep in mind. And if you do the avoid and think about it all the time and live your life in this way, then you can avoid frailty. And the Canadian Frailty Network has a fabulous website with a lot more resources as well. And next slide. So exercise at any level of frailty. Certainly, if you're not frail, you should be exercising so you prevent frailty. But even if you have problems with mobility, even if you have problems in needing a cane or a walker, there's exercise activity that's going to be helpful for you. There's get up and go classes for people that are, using wheelchairs. And we've seen people graduate from get up and go classes and be able to go on to OsteoFit classes as they become more robust and less frail. And next slide. And socialization, of course, is hugely important. And the thing that we see often is social isolation and people that are living their lives with loneliness. The social isolation is a definite health risk, and it's been associated with depression, dementia, and even earlier death. So the 3 Ds. But there's social risk factors and health risk factors. And so even if we don't have a person that's socially isolated yet, if there are risk factors, then we can intervene and offer them support. So people that live alone or who have had life transitions like loss of a partner, recently widowed, those are the people that we really worry about. Those that really recently lost their transportation, lost their driver's license, those living in rural settings with not a whole lot of community support, small social network, small cultural groups with English as a second language, etc. And then in the health risk category, people that have mobility problems, chronic disabilities, people with psychological, cognitive disabilities, early dementia people, they're the ones that really are at risk for social isolation. And so as healthcare providers, we always look for those risk factors and try and intervene. But with social prescribing, this is where we really can intervene as well. So the idea of social prescribing, which I'm going to hand over to Margaret to talk about, comes from the UK, where they've shown that 20% of the visits to their family physicians were things that are associated with social issues and not medical. And as a family physician, I can say for sure, I've seen a lot of patients come into my office with social issues that really didn't need medical intervention, but needed somebody to really understand their situation in life and provide them with that support. And in UK, they've shown that through social prescribing, they've actually been able to reduce a number of visits to hospital and to family doctors. And so this is just increasing the health of the population. And the next slide, which is my last slide.
I think that is it.
That's it. Okay. So
now you have learned about frailty. We can get to the other topic, which is how social prescribing can support you. And so we're going to do a little info on what it is. So what social prescribing is, it is a mean for healthcare professionals to refer people to a range of local and non-clinical services. So services in their community and as non-medical. And you've already heard UK several times today, but the idea did originate in UK since the late 90s, actually. And right now, just in this year and a bit last year, it has become a long-term strategy for the NHS. So they're building and integrating social prescribing into their health system. So that is UK. And in Canada, it is something that is still growing. So there recently is actually a new organization developed called CISP, which is Canadian Institute for Social Prescribing. And they're based in Ontario, but they're really helping that effort to bring social prescribing together in Canada. But there are currently different separate projects in Ontario and BC and Alberta that is about social prescribing. And today we're mostly going to share with you about what is happening in BC in terms of social prescribing. So they are programs that are funded by United Way. And there is one seniors community connector like Sandy in each of the city right now. And where my role and Grace's role kind of comes in is from Fraser Health's perspective, we really want to support this integration so that everyone can access social prescribing and your care providers will be knowledgeable about what it is so they can support you on this. So in BC specifically, our social prescribing program is for older adults. So it's a way for healthcare professionals to refer older adults to local and non-clinical services. And I realized before I move on to this slide, I never really talk about why I'm here. But I work for Fraser Health with Dr. Grace Park, and I'm a social prescribing change lead. The person that's trying to help support this integration. And that's why today we really want to share with you what we're doing and how you can access these resources. So this is what we mean by social prescribing as a process. So here on the left-hand side, we have an older adult. And when they go to the healthcare providers, if they express this need, or the healthcare providers maybe use that frailty identification, or during their care assessments, they realize that there's a need for non-medical resources. So then the healthcare provider will make a referral to Seniors Community Connector. And then from there on, the community connector will get in touch with the client and do a full intake and tailored wellness plan to really figure out what you need, what you prefer, what are some barriers that maybe has been preventing you from accessing resources, and then to really guide you and to do it step by step with you to figure out what resources are available and how you can access them. And some of the resources could include back to healthcare services. It could include transportation, for example, helping you fill out application for HandyDart or providing taxi vouchers, volunteer drivers, or it could be housing, which we know is a big consideration and big thing that needs addressing in BC. So it could be about housing. It could be about social activities. So peer support groups, it could be walking group, book club. It could be also for nutrition support. So accessing food bank, how to apply for that. Maybe Meals on Wheels. Maybe it's a hearty meal that is designed for people with heart condition or specific medical concerns. It could be physical activities like yoga class, or maybe just even getting a physical activity pass into the community center. So it can be very diverse, but the Seniors Community Connector is the person who is very knowledgeable about what is available in your community, and they can support you through that process. So really, it is a team approach because it is a plan tailored to you, and then it's a partnership with your Seniors Community Connector as well as your healthcare provider. Because after talking with you and developing the plan with you, the connector actually sent back a care plan back to about you, about these non-medical needs, back to your healthcare provider. So mostly the GPs and NPs, if you have one, and then so your healthcare providers can also know how to integrate these care plan into your healthcare. So it's not just medical, and it also addresses the social needs. And before I get here, any questions about what social prescribing is? Okay, no worries. We still have many slides, and we have a bunch of time for us to talk. So talk together. So how you can join social prescribing, or how you can share with your friends and family, let them know about social prescribing, is if you live in the Fraser Health region, because since we're doing a bigger integration and partnership, it is available anywhere. So if you go to a walk-in clinic, if you go to your family doctors and nurses, they know about social prescribing, you can mention it to them and ask for that referral, and they'll be happy to talk with you about this option. And sometimes, possibly, your doctors and nurse doesn't know about it yet, and there would be a great chance for you to let them know this exists and it's something you want to learn about. And if you or your family is involved with home health, the home health team also knows about social prescribing now, so they can help make that referral. And also the social workers, the PTs, so physiotherapists, occupational therapists in Fraser Health, they also know about social prescribing now and can help with that referral. And we're also working with several hospital units. So then when people are being discharged from hospital, that the hospital staff can either encourage social prescribing, or you can let them know about there's this thing called social prescribing and you like to be referred to it. And there's also the Fraser Health Virtual Care, which is a phone lines plus a online consultation with the nurse. So that team also knows about social prescribing. And when you talk with them, they can help identify that need. And two other method is BC211, which is a phone number available for everyone. And it's kind of like 811, but 811 is more health oriented, while 211 is more community resources oriented. So if you have any questions regarding community services, 211 is a great number to know. And pathwaysbc.ca is another website by the Division of Family Practices. So you can go on and find a bunch of community resources in your area. And in the case that if you're not in the Fraser Health region, we don't have that integration just yet, since we're from Fraser Health, but we really encourage you to talk with your family physicians and NPs, and they should have access to where the community resources are and can support you in helping you to find out. And also there is still the BC211 where you can ask them about social prescribing and ask them where you can access this support. So I'm just, oh, sounds like what I keep saying. Thank you, Marla, for the comment. And if you just need some info, so for example, you don't really need a connector there to do every step with you and then to fill out each form with you. You really just want some info on where these resources are and where you can find a transportation service or where you can find a certain resource. We encourage you to use the pathwaysbc.ca website if you're in the Fraser Health region, and we encourage you to call BC211. It is available 24/7. It is free. You really can just either text 211, like to the number 211, and then type your concern. Or you can call 211 and there is a navigator on the other hand, and they can support you on finding the resource you want. And it's confidential and it's also multilingual. So we really want to promote this. If you know how to access resources, you just need a few phone numbers. But if you're your family member or your friend or anyone you know, they really need that hand holding, or that confidence building, or really need some help to remove barriers, or it's a bit more complex and they would need someone to do it with them, then social prescribing is a really good way to start. And on the other hand, if you're listening to all of this and you think, well, I don't really need any support right now, but these seems pretty cool. All of the social prescribing programs are recruiting volunteers. And this volunteer role can really support the connectors in supporting more clients. So if it is something that you're looking for, they're always looking for volunteers. And maybe Sandy can talk more about it when she shares her stories. But volunteers are vital in this process. And I'm just gonna check the care box right now. There's for Surrey residents. So I see that Chi Ying, you shared that a website that is by diversity. So that is for Surrey. And then for other cities in Fraser Health, there is also social prescribing. So for example, I see some people today are from Burnaby. There is one in Burnaby, which is by Mosaic. There is one in Maple Ridge and Pitt Meadows. There's one in Tri-Cities, White Rock, South Surrey. There's one in Chilliwack. And Chilliwack actually covers Harrison and Agassiz. And there's one in Mission as well. I saw someone is from Mission today. So everywhere in Fraser Health, they all have a social prescribing program and a connector that can support you. And in terms of Vancouver, I believe there are 3 programs depending on which area you live in, but there are 3 social prescribing programs that can support you. And on Gabriola Island, actually, there is also a social prescribing program, and there are a few in other areas. I'm just not an expert on it, but I would love to help if you'd like to share me which area you're in, and hopefully I can give you some info on that. And the third part is we really want to invite Sandy to share stories and how she has supported many clients with social prescribing. I'm just going to check the chat box one more time just to make sure I didn't miss anything. And I see Bob's comment about the paramedics and firefighters. So that is wonderful. And we're really hoping that more people can know about it and we can even integrate it better. So more people can access it. Is there any other questions anyone would like to ask before we invite Sandy to share more stories? No? Okay, we still got time, no worries. Sandy, would you like to introduce yourself to everyone?
Hi, I am the Seniors Community Connector for working out of Community Services Building. I look after Pitt Meadows and Maple Ridge, and I have been in this job for just over 2 years now. I was brought on at the beginning of COVID, which made it extremely challenging on my end because first off, I was trying to get into the doorway of the clients that referred over to me, and then finding the resources that could help them during a pandemic was definitely a challenge. What I did first off when I got the job was got my RAC cards made up, went around to the walk-in clinics, the Salvation Army, the food bank, anybody who would let me in the doorway, basically. I introduced myself, said, this is what I'm doing. I'm here to work with you and not against you. And how can we support the seniors in our community? And at first it was not really received well. And people were like, oh, no, you're here to work against us. But then eventually the doctors got on board and started referring clients over to me. A very large portion of my clients get referred to me through urgent primary care. Physicians, nurse practitioners, Salvation Army sends me people, the Food Bank, Fraser River Indigenous Society. They can self-refer, and family referral works very well also. My clients can be in need of social interaction, wellness phone calls, food bank registration, social activities, anything, any form of paperwork, filling out applications for Handy Dart, the taxi savers, even how to maneuver getting around the town in a bus. Senior center is a big one. And this senior center, I say to all of my clients that I've helped register with the senior center that I will do 2 or 3 classes with you, and then I will leave you on your own to make friends and that. So I have attended chair yoga, hula dancing. I play pool with a senior every couple of weeks, and I'm getting better at that. And beading is another one that is very popular, but it's just that my goal with my clients is to help them have a better, happier life living in their own environment and still feeling like they're a part of the community and still feeling like people care about them. So I have lots of good stories. Do you want my stories, Margaret?
Yes, please, Sandy.
Yes,
And I'm
you
gonna
want.
pull up a few pictures to help you
Okay.
remember all of those, if possible.
Yeah. So I'm very fortunate where I work because I have access to Meals on Wheels, legal aid, the party bus, and Better at Homes. So we do a lot of great activities with the party bus. We do picnics in the park, and we invite seniors from all the programs. So one of my seniors lives on the 3rd floor of a building without an elevator, and she cannot get out of her building. So when she was referred over to me, she had not left her building for a year and a half. Groceries were delivered to her, prescriptions were delivered to her, but she had not been outside for a year and a half. So it takes 2 to 3 people to get her down 3 flights of stairs and into the vehicle. And I took her to a outdoor party bus event where she just sat in her chair, and we had tears because this is the first time she's been outside in about a year and a half. And this is the first time she had been around anybody other than the people that are dropping her groceries off at her doorstep. So we sat in the park with her for 2.5 hours while she had lunch with a bunch of other seniors. And there we had live entertainment, and she cried because she had not been outside around other people for a year and a half. And that just made my heart very happy. And we continued to carry her down 3 flights of stairs in her apartment and load her up into the car to go to other events, which is very heartwarming. I can't imagine being locked up in your apartment for a year and a half, not having any kind of social interaction. So we have that happy story. And then we have another story about a person who she had contacted 211, and she was in desperate need of groceries. She had 2 cans of tuna left in her apartment, and that was all she had to eat. And she was prepared that this was the day that she was going to die in her basement suite, and nobody would find her until her landlord came to look for her rent. And I got her number that day, and I phoned her, and she actually answered the phone. And she cried because somebody was actually caring about her. She didn't want to give me her grocery list, but she gave me her grocery list, and I went and got groceries for her and took her over her groceries, restocked her cupboard with food, got her registered with the food bank, and she has regular weekly delivery now. Got her prescriptions filled for her, which she had been without those for probably about 2 months now, and set her up with a volunteer that does wellness visits and phone calls with her. Then she started going outside, and then she was on her scooter one day and was hit by a van while she was crossing the crosswalk. So then we had to navigate ICBC with her and claim, getting her a new scooter, getting her scooter replaced. And to make a long story short, she calls me her angel. And we have now moved her into the apartments above where our building is. We have 95 affordable housing units. Got her into one of those buildings, apartments, got her registered with the party bus. She is attending events regularly now, and got her rent subsidized. So now she is a much happier person, feels like she's an active participant in the community. And that's the goal for social prescribing, is to let them know that even though you're aging, you can still be an active participant in your community, and you still matter, and people still care, which I think is a lot of people are missing out on, and a lot of people are missing that in their lives, that their kids grow up and they all have their own lives, and they just kind of get forgotten, which is really heartbreaking for a lot of them. I just saw one of the questions, Margaret, that they can self-refer. And yes, I do take self-referrals as well. I get quite a few self-referrals, actually. And they just need to know that, I think once they realize that there's actually resources that they can access to make their life a little bit easier so they don't have to struggle so much is a big thing in this program.
Grace and Sandy, anything else you want to share before we finish?
I would just like to say that I think I say this at everything that I talk at, that it's inevitable. We all have aging parents, we all have aging grandparents, and we're all going to age. And I can only hope that programs like this are available for me to access as I get older, because really all people need to do is reach out for help and say, this is what I need. What can you help me with? Like, what is out there? There's so much out there that people don't know about. And I've been given the gift of making people's lives much easier. And I'm grateful every day when I wake up that I have a roof over my head and food on my table, because the people that I meet in this job, they're struggling, and there's no reason for them to struggle because there's so many services that they don't know about. And I'm lucky enough to know what services are out there. So I want people to knock on my door every day and go, I have a problem. How can you help me? Because it's out there and people just need to ask for the help. And I hope when I get older that it's still around and I can access it.
Well, we'll keep working on it, Sandy. I just want to say, I think it's really important that we open ourselves to the notion of reaching out early. So when you're still, functioning well in your community, to make it an acceptable thing to reach out to community centers for programs, community organizations to learn about different things, and, clubs where you can socialize, like the Quilt Club, or wherever you might want to get together with like-minded people. And, for men, we have the men's shed, and this is where men get together and have common interests that they can share and talk about. So to do this early, I think, is really important, because then when you get older, and say you do have problems with your memory or you have problems with your mobility, then you can start reaching out for more help, and you might need more intensive help at that point and need connection to the health sector, and say you need to get somebody into the home because you need help, with supports in the home, etc. So the idea of reaching out, I think, is something that we should start early, and to be watching for neighbors who are isolated and to work with them to try and make small steps to reach out as well, because we really do need to reach out to those that are tending to be socially isolated.
Yeah, thank you, Grace. And I guess some words I will want to add is that we hope that today's presentation is not just something you see and then you can kind of forget about it, because you are a very vital part as well in this. Like, whether you can share this info that you learned today to any of your friends, maybe your doctor or the nurse, or maybe it's for yourself, to your family member, to a neighbor. That would be very, very helpful. Like, I started as a nurse and I never knew this. I never knew this exists, but if one of my patients have told me, I would be so thankful for that. And so if you can share this information around, that would be great. We have some resources that I know Mary Lou and Christine can help us share out with the newsletter, some poster, or just some info in general, if you could help share that along, so more people can talk about social prescribing, and then more people will know how this can help people. That would be amazing. Or if you want to become a volunteer, we always need volunteers. So there's many ways you can help. And thank you so much for joining us today.